Welcome to Dementia-Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is Dealing with Behavioral Issues in Dementia by Ann Crayon, sponsored by Prince George's County Government and Department of Family Services.
It is a pleasure to speak with you guys. This is an important issue for caregivers, for people who are dealing with the decline of their loved ones. So I wanted to kind of talk about first, define kind of the issue of behavioral problems and what we're talking about there. So people who are aging with Alzheimer's or another form of dementia often experience personality changes and cognitive impairment that causes irritability, resistance, mood swings, and often just a general lack of cooperation. And this can get worse as their condition progresses. So understanding what causes that, causes them to do that, to demonstrate these issues, can help you manage their behavior and also manage your own stress, which if you're a caregiver, you're experiencing, you are not unfamiliar with stress. So this is behavior. You have to think of behavior as communication. Even, for any of us, behavior is communication. For someone who's a senior dealing with cognitive issues and impaired ability to communicate, you have to really work at figuring out what that is. So they might be communicating they're in pain. They might be communicating it's too noisy. I'm sad. I'm lonely. You're rushing me. Boy, that's a big one. I'm hot. I'm cold. And they don't tell you this. Or I just can't understand you. Or I feel useless. I don't know what to do. I'm scared. Any of those. And you have to really kind of be a detective, I'd say. We'll get to that later. So unaddressed behavioral issues, the ones that you haven't figured out how to handle, they are burdensome to you, the caregiver. They can be unpleasant or embarrassing for the person you're caring for or for yourself. They increase the risk of the caregiver burning out. They increase the cost of care. They increase morbidity and mortality for caregivers. I think that's important to note. For caregivers, something like, I was looking it up today just to get updated statistics. 40% of Alzheimer's caregivers die before the person they're caring for. 40%. If you're an older person caring for someone, 70% of all caregivers over the age of 70 die first. So we're looking at spouses caring for someone with dementia or an older, I have a number of clients where it's an older child caring for a parent who has lived a long time. And caregiver syndrome is a real thing with real consequences. And we need to make sure you're taking care of yourselves. Let's see. Unaddressed behaviors are seen at some point during the illness in 90% of people with dementia. And I'm going to say it would probably be 100 and nobody caught those other 10%. Let's see what we've got here. So you have to remember that the behavior is not the fault of their loved one. It is their disease, is an aspect of their disease. And with dementia, they're kind of suffering from brain failure. And we can have a lot of sympathy when someone is suffering from heart failure, when one has cancer, whatever, but dementia is just really different because the person looks the same, and our patients, we know what's going on with it, and even sometimes after, we can blame them for the behavior. But remember that behavior is communication. So before we get too far in, I want to caution you, be aware of the 3 Ds, dementia, delirium, and depression. And there are high rates of delirium and depression reported in people with dementia. So the conditions may coexist. They might need to be distinguished and addressed separately, but certainly dementia is a risk factor for depression. If I know I have dementia, I am probably going to be dealing with some depression until I get far enough along in the dementia that I no longer am concerned about that. And both dementia and depression are risk factors for delirium. So depression and delirium may be with apathy or withdrawal, tearfulness, and delirium occurs suddenly when you see a dramatic change in your loved one or the person you're caring for. You need to look at, is there something else going on? Is it not just the dementia? Because you don't want to overlook those things. And delirium also tends to fluctuate throughout the day. Depression, I think most of us would know, is a negative change in mood, and it persists for at least 2 weeks. So you might be down one day. If it goes on long, for over 2 weeks, it might be considered as depression. Whereas dementia is slow and insidious in the way it presents. Differentiating them one from another requires knowing not just the features of each condition, but what was this person like before their diagnosis? And this is where, as a caregiver, you come in. You knew that person before, and you are their advocate. We want to be sure that we're not missing something in our caregiving. So if you have somebody with dementia who suddenly things take a real uptick, then we might be looking at, are we looking at delirium? Are we looking at an infection? And we'll get into some of this as we go on. But when you see a dramatic change that it doesn't last an hour, but that, continues, it's worthwhile to consider other reasons for that behavior. So in order to address these behaviors, you have to become the detective. You're the one that knows your person. You have to figure out what they're communicating. So you're going to see this little spyglass, magnifying glass for a while here. So you need to think about the person you are caring for. We like to say that if you know one person with dementia, you know one person with dementia. And I often say, on some level, it's not whether it's Alzheimer's or vascular dementia or frontotemporal or any of these other types. It's Bob's disease. It's Susie's disease. And you have to figure out how to care for Bob and Susie. And you have to think about them. You have to think about their family culture, their medical history. What are their habits? What might be different, and a change in behavior for someone else might be a lifelong habit for the person you care for. Think about their work. Somebody who gets up at 4:30 every morning and disrupting your sleep certainly could be a problem, but if they have a habit of their lifelong of getting up at 4:30 to head out to work, it explains what's going on. And you have to think about their religion and things like that, and just how that impacts behavior. And you have to identify the problem before you start trying to fix it. So when did the behavior start? Is it sudden? Is it gradual? Does it occur at certain times of the day? Does it occur all day long? What preceded the problem? Was somebody here visiting? For my mother, we had a particular caregiver who started telling me that my mother was aggressive and resistant and all that, which totally did not describe my mother. And then I realized over time, it was the caregiver. The caregiver was just kind of pushy, and my mother didn't like to be pushed. You have to figure out, is this in relation to what's going on in the house? Another case with my mother, she got very upset one day because she thought my daughter was going to run off and get married. Well, there was two things going on. My daughter had graduated that day and was going out with some friends that night. And my mother watched Little Women on TV, and one of the daughters gets married, and she was sure that my Meg, unlike Meg in Little Women, was running off to get married. So what's going on in the house can affect the behavior. And then just how does it relate to the whole family dynamic and the social history for that person. So you got to try to identify what's going on before you try fixing it. And you got to think about what are the potential sources of the behavioral issue. There could be multiple contributing factors. Let's see. So the investigation begins, and the behavioral issues might actually be expected behaviors within the context of dementia. So we're going to look at these 4 different things to kind of help you. One is amnesia, aphasia, agnosia, and apraxia. So amnesia, we're probably pretty familiar with. There's a behavior loss or a memory loss. And the behaviors might be someone who asks the same question over and over. When's Bob going to get home? When's Bob going to get home? Or they've forgotten that a family member has visited. They lose their things and accuse someone else of taking them. They forgot that they've eaten and they want another meal. They think they've already eaten and they don't want to eat when you bring their meal. They get kind of hung up in the middle of a task, like getting dressed. Those are related kind of to memory loss, the inability to kind of think it through properly. So your responses there would be, gosh, patience. And boy, if you're a caregiver, you need patience above all, just kind of continually. A routine is really helpful for people with dementia. And I think it's important to note that people with dementia often lose that ability to initiate a task. Like people early in dementia, well, if Dad would just walk, it would be so good for him. He doesn't have the ability to initiate that walking task. So routines at bath time, many routines are really helpful for people with dementia. In the morning, we get up, we do things in the same order, and it helps them to know what to expect next. Giving directions one step at a time, and not, Mom, get dressed, come in here, take your pills, eat your breakfast, and I'll be back in a few minutes. That's not going to work. Be prepared to repeat as needed. And secure belongings, things that are valuable. Label things, that's really helpful. I've had clients where they wanted to give away something, and so we take a picture, we have them write a note, I gave this to so-and-so, because they might need to be reminded that they gave it away to a loved one or whoever. Use distraction and be reassuring. Those things are really important. And I would say it's so easy to say, don't you remember we're going to do such and such? Or do you remember when we, and it's so much easier for someone dealing with memory loss if you just say, I was thinking about the time this happened, and not do you remember, but here's this thing I brought you. I want you to eat this. It's right here in front of you. Not, I left this here, you need to eat it. And I told you already that's not going to help them. Aphasia is that ability to understand or express speech. So one thing is, people with dementia sometimes seem uncooperative because they've lost the ability to understand the instructions you're giving them. You might need to demonstrate. I'll probably go back and forth on this one. You might need to get down at eye level, speak in a lower tone of voice, speak slowly, simplify your language, and be willing to say things more than once. They might strike out if they can't communicate their needs or wants, or if you start trying to help them dress and you're in behind them, that's going to be very off-putting. Or if you get into their personal space, that can again be off-putting. People with aphasia become isolated. They can't communicate. They may misinterpret what you said. You have to observe their nonverbal behavior and use your own nonverbals and gestures in addition to when you're talking to them. Would you like to put your sweater on? Hold the sweater up. And again, be patient, be patient. Agnosia, and I was talking to somebody about this earlier this week, the inability to recognize sensory input like sight or light, sound, touch, but in addition, not necessarily recognizing what they're seeing. They might, it's right there on the table right in front of you, but their brain has to process, that's the item that I needed, and recognize it. They may not recognize a very common item because their brain has to do the work to translate the visual input in their brain. They might not recognize family members or familiar caregivers. They might not recognize themselves in the mirror. And I had with a client one time where he thought his wife was having male guests because he didn't recognize himself in the mirror, and he was rather upset that there was a man coming in their home. And we finally figured out, oh, he's seeing himself in the mirror and doesn't realize that's him. Another thing on these responses you might do is introduce yourself. You know, hey mom, it's Sue. Da, 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 da. Maybe you don't need to do that. Maybe your mom does recognize you, but it doesn't hurt to just put that out there. You know, unless of course that bothers them, then it hurts. But they might walk into things. That's why it's so important to have clear pathways in the home. Because somebody with dementia, over time, their gaze tends to go down, and it tends to be just right in front of their feet. And they might walk into things, slip on things, get bruises, all of that. They might want to go home when they are home. And what that communicates is, I don't feel home. Or maybe they want to go to their home that was their home when they were a child, and they know they're in an unfamiliar place. They might be bored, fearful, distrusting, anxious, and all of those things. And you are there to reassure them, to distract them. When somebody gets really upset about something, I often say, okay, it's not the time for the bath. If you can reschedule it for later and try to get all the things in the right place to help make that bath time more pleasant, but it's not going to help you to go up against them when they're already upset. Let's see what we got here. Apraxia, the inability to execute a voluntary motor movement despite being able to demonstrate normal muscle function. So this would be like somebody who doesn't feed themselves or can't take a drink of water on their own, but they can drink and they move their hands, but they don't have the ability for their brain to tell their limbs what to do and to process all the pieces. They might put their clothes on backwards. They might be unable to safely shave anymore or brush their teeth, unable to use a knife and fork. Number one on the list over here on responses, again, be patient. Observe what they can do and where the process breaks down. Maybe if you get the toothbrush ready and put the toothpaste on and hand it to them, maybe then they can brush their teeth, but they couldn't have initiated the task. Maybe they can't, but if they can, that's great. Minimize the clothing processes. I would say like a closet full of clothing, not helpful. Have a few choices that are appropriate for the weather, for the temperature they're going to be in, and make that easier. Simplify things one step at a time. Lay out the clothes rather than asking them to go to the dresser or the closet and choose the clothes. Provide them the items in the order of use. So, you know, here's your underwear. They get that on. You know, here's a blouse. Do it one step at a time. The other thing that can be helpful is finger food, because the ability to use the fork and spoon and get things to the mouth safely can become a problem. And you can use hand over hand cueing. So you've got that toothpaste on the toothbrush and you kind of get them started, and they may be able to then go on and get the task going. So we're going to keep investigating. Are the behavioral issues related to medical problems? Could be, especially with abrupt onsets of behavior changes. So are they in pain? They may have a different way of expressing pain. They may not even recognize they're in pain. So you might get somebody who's rocking, and maybe they're achy, maybe they're cold, maybe they just like to rock. You have to kind of use that magnifying glass and do your detective work. If they have confusion that is new to them, a level of confusion that is change dramatically, then we might be looking for, is there a medical problem? Are they harder to awaken than usual? Again, is there something going on? Is there a delirium, something that came on pretty quickly? It could be a new meds, a cumulative effect of the medications over time that they've built up a resistance to or a problem with. Could be an infection. Urinary tract infections are notorious for causing increased confusion in older people. And with somebody with dementia and a urinary tract infection, it can go off the charts. And it could be a new medical problem. They could be having a stroke. They could have an electrolyte imbalance. And sodium imbalance, potassium imbalance, those can throw people way off. Here's where we're talking about that. They may express pain differently. They may not wince or grab the area. They may be agitated. They may rock. They may shout. They may refuse to eat because they've got a problem with a tooth. They may not be sleeping. They can't reliably self-report pain. Heck, sometimes I have a headache and I can't reliably self-report it. I don't realize it until it's gotten bad sometimes. But they may not have the verbal skills to say, I'm in pain, what can you do about it? So you need to be observant and be looking for those signs of pain. There's a really helpful tool, I should put this in here, but I didn't, that hospice uses, and you can probably Google the face pain chart. And they give you a little box that has half a dozen little faces in it, and one is smiling, and on, and then down right to a scowl. And for somebody who doesn't communicate, sometimes being aware of the facial expression and what their normal facial expression is. Some people have just a resting kind of cranky face, so that might not be helpful. But I know with my mother, I found that helpful. Like, okay, yeah, this is different. She's off. Something's not right here. So even if they're asked about pain, they may not acknowledge it. And they may not remember that they were in pain. I had a client who was in a dementia, like a memory care unit, and all we can figure out is that she must have gotten up in the night and fallen and gotten herself back into bed. Nobody witnessed the fall, but all of a sudden she wouldn't participate in physical therapy. She wouldn't walk at all. We ended up getting an x-ray. She had a hip fracture. Nobody noticed it, and she was a tough cookie, so she had to have gotten herself back up and gotten herself in bed. So this is that you're the investigator for what are these behaviors attributed to. And again, they need you to advocate for them. When you see something that's different, you need to have the confidence to say, nope, something's different. And I want a full screening. I want, if they won't walk, get an x-ray. If they won't use their arm, ask for an x-ray. You're their advocate. You're the one who can make sure that they get that care. And even in a facility, those people don't know your loved one like you do. Let's see. So physical and medical problems, it could be infection, delirium, a chronic illness, a new illness, pain, sensory impairment, or it could be unmet needs. That could be what's causing the behavior. So are the behavioral issues related to mental health complications? Are they depressed? Are they anxious? Are they apathetic, which could look like just resistance? Do they have a psychosis, in which delusions are more common than hallucinations? So a delusion is just a false belief. Like I knew somebody years ago who thought she was the president of the United States. She thought she was, I think it was Teddy Roosevelt. This was many years ago when I was in school. So behavioral issues like this may have a slow, gradual onset. And I will say, if somebody, and maybe it's on the next slide. Yes. So behavioral issues can have a slow, gradual onset. And the other things to think about, were there mental issues before the dementia? And for most seniors, mental health, unless it was extreme, went undiagnosed. For people who are now in their 70s, 80s, 90s, it just wasn't diagnosed. We didn't have the acceptance of, nor were there as many treatments for mental health issues. Behavioral issues that are related to prior illness that precede the dementia can persist, diminish, or worsen. So I knew a client who was quite unaccepting of people of different cultural backgrounds as a younger person, and it created a lot of issues within her family. And with dementia, her very best friend was her caregiver, who was from another culture. The family was astounded. It's like she forgot she was prejudiced. But things can get worse, and the behavior that, mom was a little intolerant, she can become a lot more intolerant. So are the behavioral issues related to the mental health issues? Are they related to complications? Are there associated symptoms? This kind of helps, all of this helps you proceed, but doesn't mean that getting help, getting other interventions won't help you. So then we look at, are the behavioral issues related to the environment they're in? Maybe, is there noise? Are there distractions? The heat, the cold, overstimulated? People who have dementia have a difficult time having a conversation and filtering out other noise in the room. And they may not be able to pay attention to you when the radio's on or the television's on or there's a conversation over there. I often will take a client and kind of pull them into a quiet room if they live in a community, because then you've got a one-on-one. So if you really want to communicate, but noises, a banging pipe or trash trucks outside can be distressing. The heat and the cold can be distressing. And at the same time, people with dementia don't always recognize or respond to heat and cold appropriately. Some people find the chaos and clutter, and apparently I can't type the word clutter properly because there's 2 L's in clutter. Not that I get distracted easily. So, they might need a room that is fairly absent of clutter. So I often find, like making sure the dressers are cleared off and putting away things, leaving out a few things that they will enjoy, that anchor them to who they are, who their history, maybe, if there's some family pictures out. But if there's a lot of stuff around, they're going to be often getting involved in all that stuff, or maybe upset by all the stuff and feeling like they need to put it away. That's when people start hiding things. So when you're dealing with those environmental factors, kind of stop and evaluate the surroundings, eliminate distractions, see if that helps their behavior. Turn off the radio, the television, provide some structure. And I will say, remove other people when appropriate. If you have a caregiver or a friend or somebody that your loved one just butts heads up against, that person doesn't need to visit. And you don't need their help, because it's not going to be beneficial. That can be difficult to do because sometimes it's a family member that gets your person all upset. After I keep saying Bob and Susie, but after they visit, maybe mom is upset, and so then you limit, or you're present during Bob and Susie's visits, or you give them a window of time, because clearly, if they're children or close relatives, you can't always just cut off their access, but you might limit it. You might make it an event. You know what, let's go out to eat, or let's go to the park and Bob or Susie is there. Those family relationships can be difficult to navigate when you're dealing with behavioral problems. They can be difficult to navigate anytime, really. So as we're finishing up the investigation, you want to look into, are the behavioral issues related to the structure of the day? Is there poor scheduling? For instance, you have somebody who always bathes at night and you're trying to do their bath in the morning. They may be resistant. Mealtime may not be occurring at the right time. They may be getting hungry earlier than you realize, or they may be stuffed and you're trying to feed them. And again, that lack of routine. And I'm not a particularly routine-driven person, but I know there's a great book called, I was looking for it, Atomic Habits. Routine really helps, and building in a routine. And I often say, have a schedule. Like, write it down on a whiteboard or print it out or something. If you're the caregiver, your schedule for the day would get mom up, get dressed, sit in the sun, have your tea, put out your pieces. It can be helpful to you to keep you oriented, but also somebody who can still look at that schedule knows what's coming next. And if you do it daily, you can, write in doctor's appointment. If you had it on a whiteboard, you wouldn't print out a daily schedule, I don't think. And be aware that changes in caregiver, changes in location, season, all of those can affect the day. And then we have to consider someone's preferences. They're not necessarily going to, in fact, back to my mother, I fixed her one night a tuna casserole that she served us countless times when I was a kid. And I took it downstairs, I fed her, and she said, "What is that?" And I told her it was tuna casserole. I said, "This was your recipe. I wouldn't have fed that to anyone." So clearly her preferences had changed, but I'm telling you, we ate a lot of that tuna casserole. So, people's tastes change, and they lose the sense of taste sometimes too. And also with dementia, they often lose the sense of smell. And that's another thing. So a fragrance that makes food appealing, the fresh bread or the dinner cooking in the oven, they may not smell that, and it may not stimulate their appetite the same way. Also, eating is pretty social. So putting a meal down in front of somebody and walking away, much as we might want to do it sometimes, is not going to encourage them to eat if they're not eating well. But I can relate to just wanting to give somebody their food and move on when you're tired and it's the end of the day. Let's see. So the behavioral issues related to the caregiver approach. Are you hurried? If you try to hurry someone with dementia, whoa, you're going to be in trouble. I always say you allow 2 or 3 times as much time. If you show up at 1 o'clock to take mom to the doctor and her appointment's at 1:30, you're going to have trouble. I don't care where the appointment is. Are you hurried? Are you impatient? And I've got to admit, I've certainly been impatient as a caregiver. Are you argumentative or demanding? And I think, I don't think we talk about this in here, but I'll say, boy, when somebody gets upset, the easiest thing to do, you're treating me like a child. One of the hardest and yet one of the easiest things to do is to apologize. I'm sorry, I didn't mean to be treating you like a child. I'm sorry, I was wrong. Like we want to be right. All of us wants to be right. With somebody with dementia, if you're right, bully for you, the goal is to get their cooperation. And if helping them to hear that you understand their issue is going to be helpful to them. There's a woman, I think I have this logged or reference later, named Teepa Snow, Teepa Snow, like the white stuff that comes down. And she teaches some classes you can pay to take, but there's a lot of short videos on YouTube that she does. And the one about apologizing was so meaningful to me. Just, I'm sorry, I forgot, blah, blah, blah. I'm sorry, I didn't mean to rush you. I'm sorry, I didn't mean to make you feel like a child. None of these things, they don't cost us anything, but apologies are often hard for us to come up with. But if you can come up with that, teach yourself to do that, it can really smooth a lot of ruffled feathers when you're dealing with somebody with dementia. So, are you hurried, impatient? Are you angry? Are you being argumentative or demanding? And you know what? You're entitled to have a bad day, but it will impact the person you're caring for. Or could you have inappropriately addressed the problem? Maybe I misidentified it and now they're all upset. I think when you're feeling impatient or angry, etc., oftentimes, just take a minute, take 10, go out of the room, take some deep breaths, go for a walk around the block, whatever it is you need to do. And if you can't leave the house, which sometimes when you're caring for someone with dementia, you can't, just go in another room, take a few moments, read something that's helpful to you. Let's see. So evaluate your approach to your person with dementia. Are you greeting them? Are you coming in, here, it's time for us to get ready? Or did you say, good morning? Good morning, Mom. Good morning, Anne. Helping them to know that you recognize them. Getting down again at their level and talking to them. Avoid rushing them. Avoid being demanding and certainly threatening. Arguing and even reasoning. If you do this, then we can do that. That's reasoning something through with someone who has dementia, whose thinking is impaired, is seldom going to work well. And are you inflexible? And boy, I can be inflexible sometimes. And it's like, this was the time I had slated for the bath, but maybe she can get a bath the next day because we can't do it today and can't do it right now. And maybe I don't have time later. I need to be able to be flexible. Let's see. So here's some ways to make some modifications for somebody who has some real behavioral issues. Plan some quiet times, morning and afternoon. Some stimulating times, but kind of alternate those. Observe them. Watch for when they get stressed, when they start rocking. And when things like that occur, reduce stimulation. And I've said this in other ways, retreat. Stop what you're doing, let them rest, or distract them with something else, and think about their preferences, their habits, their personality, because somebody who's a real people person might enjoy, even in dementia, a lot of people around. Somebody who's a introvert, probably not. So you have to think about, if this is your family member, you probably know what they're like, and all that has to be factored in as you're working on modifying behaviors. So that's all kind of identifying what's going on. So you're going to change something. You're either got to change or more than one something, but try one thing at a time because you won't know if it's working. Change your approach, change the environment, make it warmer, quieter, whatever it is. Change the schedule or the time of day that certain things are being done. Employ a behavior-specific intervention. Gee, I hope I explained that. Nope. So I don't know exactly what I was thinking there. So maybe we'll come back to that if somebody has a question. Maybe it'll spark my memory. Let's see. So then when you go to make a change, be sure you have a clear goal. So Mom is calling out, and my goal is, for Mom to call out less often. Or let's come up with something that's a little simpler to talk about. Resisting bath time. So the clear goal is we get a full head to toe kind of shower once a week or twice a week. Make sure everybody who's involved, if you have caregivers, if you have other family members, that everybody knows what the goal is. The goal is we're going to get a shower once or twice a week. And consistency is critical. So having everybody be on the same page and not, no, Mom, I don't know why you're trying to force Mom to take a shower. She's fine. Everybody needs to be on the same page, and somebody's got to be in charge. Somebody's got to wear the hat, the in charge hat, so to speak. And I will say with bath time, boy, I found a huge difference when we started heating towels in the dryer so that they were nice and warm when my mom got out of the shower. And I've done that with clients too, like with a terry cloth bathrobe, get it in there. And boy, they didn't mind it when they felt like it was more of a spa treatment as opposed to, you don't smell good and I'm going to make you take a bath kind of vibe. And so then once you've tried your plan and your new thing, stop and be kind of deliberate. Think about it. What happened? Did it happen as I planned it? What was working? What didn't? You know, if I going back to the spa, if I put a nice fragrant candle in the bathroom and mom's reaching for the flame, that doesn't work. But maybe mom loved it. What adjustments in your plan need to be made? Develop a new plan if you need to. Try something else. If changing the environment didn't work, change your approach. If changing your approach didn't work, change the environment, and so on. So in general, for communicating with someone with dementia, approach them from the front. Make eye contact. Greet them calmly, friendly, pleasant. Introduce yourself. Be sure to provide their hearing aid or glasses if appropriate. Make sure they're using them. Use humor and to the degree that you can, be cheerful. And when you are a sole family caregiver, that's a lot. And we're going to talk about some of that caregiver stress too. Adjust your expectations to their abilities so that you want them to walk faster, but they can't. And so you need to slow down. Or if you're going somewhere out and about, maybe you need to get a transport chair and not expect mom to get out, to walk into the doctor's office, to walk down into the building and walk down to the hall to the office. Maybe your expectation is unreasonable and they're getting tired and they're resistant. For any of these things, it's trial and error, and it's being creative. It's trying new things. And I can't emphasize enough, it's knowing the person you're working with and observing their behaviors. Adjust expectations to abilities, trial and error. Oh, medication may be needed. That's fair. Although I will say, with my, you have to go to the right doctor and understand that it may be that behavior is annoying you and it's causing the person you're caring for no problem whatsoever. I had a neurologist tell me that the fact that this husband, it was the husband with the mirror thing, that he was so upset that his wife was having an affair right in their house, basically, was the wife's problem. The husband didn't need medication. The wife had to learn how to deal with it, which on some level is fair, but it was upsetting the gentleman as well. And I thought a little help might be necessary. A little medication might be necessary. Sometimes when people become very aggressive, they may need to be hospitalized. And there are hospitals with geriatric psych units that can take people in and just kind of work on getting a cocktail, so to speak, of medication that can help them. That's for really extreme, more extreme cases. Not everybody needs that. So some principles to remember. Preventing a problem behavior is easier than trying to fix a problem behavior. So like keeping the cluttery area clear would be an example. Your loved ones need time with you that is not care related. And this is so difficult. This is partly why I guess I have a job, but they need you to still be their spouse, their sibling, their son, their daughter, their grandchild. They need you to still be that person part of the time, and for not everything that you do with them to be related to caregiving. They start to feel like a duty, and you start to feel like they're a duty too. And often if you don't give them something to do, they will find something to do. So it's that same thing with the being bored. I used to would have people like match socks. Even if the socks have already been matched, unmatch them, put them in a basket. Hey, could you match these socks? People need to feel like they have a purpose. So try to find something that gives them purpose. Even washcloths. I can remember dumping stuff out of my closet into a basket just to give my mother something to do. And she wasn't getting into trouble, so to speak, but she felt useless. And you know what? I could fuse over, thanks, Mom, that was so helpful. I don't know when I was going to get around to folding that laundry. Thank you so much. But, we had gone from matching socks to folding washcloths. and she could still fold washcloths. Let's see. All family members or caregivers, again, need to be on the same page. They need to be informed of the behavior management plan. If your daughter, grandchild, whatever is coming in to help, you need to explain, when dad does this, here's how I address it. I need you to do that the same way. Let them repeat it back to you, or observe it. If it's a behavior that's frequent and you're trying to control it, then let them repeat back to you what you want done. Reward behaviors you want to encourage. And sometimes rewarding is a treat, and sometimes it's just, great job, thanks so much. Choose your battles. Some behavior that's annoying doesn't really matter. Sometimes it just bugs us, and maybe we're the ones that need to adjust. I had a child who ripped all the papers off the crayon wrappers, the crayon papers off the crayons. Used to make me crazy. And my mother said to me, does it matter if the crayons have the wrapper on? Well, no, but it mattered to me for some reason. So I would think I was in the wrong there, but I was tired of picking up little crayon wrappers. But it's the same thing with an older person. Like, maybe what they're doing isn't really a problem. It's just a problem to you. Maybe they get up and look out the window regularly. Okay, if they can do that safely and they're just getting up and wandering around, maybe you are the one who needs to take a break. Keep your emotions in check, and that can be really difficult to do when you are a full-time caregiver. Anticipate that at the end of the day, during times of stress, when someone's ill, that behaviors are going to be more of a problem. And that we also often talk about sundowning, when as the day comes to a close, more aggression or more issues with behavior can occur. And then, so very, very important to take care of yourself, to enlist the help of family and friends. And I tell people, get someone who knows you and knows the situation to help you create a list of things that would be helpful, because many people will say, let me know if I can be helpful, if I can do anything for you. And you don't have an idea of what they can do, and neither do they. But have somebody just help you brainstorm and make a list of, these are things that would be helpful. Somebody, if you could just come and sit for 20 minutes once a week so I could get out for a walk. It depends on the person, what you're going to ask of them. If you could come for an afternoon, if it's a sibling, helping to care for parents, if you could give me a Saturday every week, every month, a weekend, a vacation once a year, think about it. What would be appropriate? Who can you enlist? Maybe there's people from church. Join a support group. There are plenty. Dominique was telling us about some that Greenbelt has. There are other virtual support groups as well. Schedule regular time off for you and for your loved one. They kind of probably need time away from you if you're a full-time caregiver, and you need time away from them. Ideally, get a little time every day, get a longer time every week, take even a longer time once a month, periodically, some real time away. All of that is not easy. That's can be pie in the sky, but if you can do it and come up with some creative ways, figure out who's on your support team, so to speak, your own team of caring for your person, and let them help you figure out those things, or enlist them to help you figure out those things. Don't just let them. Tend to your own health and exercise, and I can't say that enough. I talked earlier about the statistics for caregivers, and it's no joke. And when you're a caregiver, you will find that your medical appointments get left, and it is not, get left behind, kind of forgotten. And I've done that myself. It's not selfish to take care of yourself. In fact, if you get some time to yourself regularly, you will be a better caregiver. And I did a talk, I think it's on the YouTube channel, on what was it called? Building your caregiver resilience, or your inner caregiver resilience. So you can check that out if you need more on that topic. So here are some resources I recommend. I have these books. I found all of them helpful. The first one, Coping with Behavior Change in Dementia, really is more in line of you look up a particular behavior. I have this book here. So somebody who's resistant to oral care, and they've got 2 or 3 pages on, maybe more than that, on oral care and ways to deal with that. Same thing with the bathroom, with showering, with repetitive behavior. So it's not a book that you just read and go through. It's a resource for a particular behavior. That I find that really a good resource. There's another book, the one here called Creating Moments of Joy, is really about with your loved ones. I have a friend who said that their husband, who had dementia, just had the best day that he'll never remember. And the idea with this creating of moments of joy is they may not remember, but that moment of joy, if you're out in public and somebody compliments you, you just stand a little taller, you feel a little better. The fact that your relative may not remember your visit doesn't mean they don't feel good from your visit, or they may not remember the special treat you did. Doesn't mean that it didn't have an impact. And this other book, Finding Grace in the Face of Dementia, is just a book for caregivers. And it's written from I'll tell you, from a Christian, from a faith-based perspective, but it's about you, and it's about how you can find grace in the face of your loved one's dementia. I think, here are some Teepa Snow videos. She's really good at this. And you can find some of those. De-escalating a crisis is a great one.
Question is, can drastic changes in behavior and confusion be associated with a full moon also? This full moon, my mom was more confused and irritable than usual. Everyone in my support mentioned the same about their loved ones.
I would say, gosh, when I worked in a nursing home more years ago than I want to say, we all prepared for full moons. We knew it was going to be rough. I have read some places people say that's not true, but it certainly seemed to be the case to me when I was working, that we knew it was going to be a rough couple of days when there was a full moon. So that wouldn't shock me. Behavior is something like you've got to take this information back and kind of think through the different steps of how to identify what's the problem behavior, what could be causing it, what can we do. It's not something that we're going to solve quickly, shall we say. You're very welcome, and you all have a good evening.